faces severe health workforce shortages, especially at the primary healthcare level. According to WHO, the current density of nurses and midwives per 1,000 population is 0.86, or in other words, just one nurse per 1,159 people. Additional health workers are desperately needed to provide essential services. Training of more nurses is a necessary step towards ensuring that there are sufficient numbers to provide safe and effective care to the population. Whilst nurse training has traditionally taken place at government-funded colleges or universities, in recent years, there has been a rise in the number of faith-based and private institutions offering nurse training programs. However, very little is known about these institutions and whether or not they will help to reduce nursing shortages.
Ever since I was a young girl, I wanted to become a nurse. I remember when I was 7 years old, my father was terminally ill and bedridden, and we therefore had to take turns between my mother and younger sister to care for him. One day I rushed back from school to assist my sister in taking care of Dad. I got home and all seemed to be well. Just when I had prepared his food and was ready to serve him, he passed on. This experience gave me the burning desire to study nursing because I felt that if I had the nursing skills then, maybe I could have been in the position to take better care of our beloved father. After completing high school, my dream of becoming a nurse seemed impossible when I was denied a chance to enroll at my nursing school of choice due to the very large number of applicants. I learned about a nursing training school from our church and felt encouraged to apply. The knowledge from my course enabled me to kickstart my dream career in nursing and work towards providing the best possible healthcare to my patients.
Private and faith-based training institutions make up almost 1/3 of admissions for nursing courses in Kenya and are now considered an important means of increasing nurse production by the government.
The private and the faith-based enroll 30% of the student population in nursing schools in this country. However, while the public institutions then are enrolling the biggest number, which is, you would say, it is 70%, when it comes to pass rate or student performance, you find that at least 40% of them not going through, and that is a very disturbing situation, which this study found out. And this is something that we want to take to the policy makers.
They have myriad of challenges while undergoing their training, and several of the challenges which have actually we've experienced and also reported to us as a regulator is first is actually the issues of disciplines cases leading to discontinuations. We are coming up with a code of ethics for students. This is under development, and it should be able to address the issues of students' discipline in addition to the progression in their training. At what point should we be able to discontinue the students? Should we be able to demote them? Should we be able to do those disciplinary measures?
However, the study found that the curriculum of private institutions is relatively limited, with less focus on teaching future nurses about public health issues.
We need to revisit the implementation of the curricula in both public and even private. But where there has been weakness of implementation, of course, is in the private side of the implementation. That is what we need to really address moving forward.
Whilst Kenya has increased capacity to train nurses in recent years, severe blockages remain in the system. In particular, many nurses face poor employment prospects after they graduate, and as a result, up to 1 in 5 trained nurses look abroad for work.
My name is Irene Onyango. I am a professional nurse, but currently I'm not employed. I'm mobilizing funds to go work abroad, like in Canada or Australia, because I've looked for a job in Kenya, but no job yet.
To overcome the challenges of recruitment, the government has been trying to increase the budget. The allocated budget for the Ministry of Health has been put up for this year. It is better than what it was last year, and we believe that this is going to improve our engagement of the graduates. We are also engaging our partners who at times they do engage the graduates, they employ them for us, they put them on a contract, and then later on the government takes over those contracts to engage the recruitees.
The research has shown that the private nursing sector plays a crucial role in the training of nurses and by extension bridging the human resources for health gap in Kenya. However, a lot remains to be done to improve the quality of training, especially in public institutions. Most importantly, 1, the government must increase funding to employ more nurses, and 2, improve health sector planning and budgeting to ensure that there are employment opportunities for newly qualified nurses.
I feel really fortunate to have the chance to pursue my career in nursing, and even with challenges in getting better working opportunities, I remain focused on ensuring that my patients have the best possible health care, just as I would have wished to take care of my late father.